For a lot of people, retirement means strolling along a sandy beach, playing a few holes at the local golf course, cruising a tropical waterway. Not for Bill and Nancy Leschide. When they retired from their medical practice a decade ago, they followed a different calling.
The end of '98, when we retired, it was the first morning, and I was planning exciting things like getting my nails done. And my husband became very pensive and very contemplative, which is his style, but it was even more, which caught me off guard because I knew retirement could cause that, but I had no clue that it would be that quick. So as a result, I'm going to get emotional over this. As a result, I said to him, what's going on with you? You know, I don't have to get my nails done. You know, what's going on with you? And he looked at me and he said, I'm being crushed by my silence.
Bill Leschide was a doctor, Nancy a registered nurse, and what was weighing on him on that first day of retirement was his knowledge of the legions of needy people who were being denied access to the health care system. He wasn't willing to walk away from them.
He said, Nancy, you and I know too much. We know who they are. We know where they are. We know what they need in health care. But more importantly, we've been in this community for so many years that we know how to get it.
So they mapped out plans to provide affordable health care to the working poor. Today, the Neighborhood Health Clinic of Naples has served more than 25,000 job-holding, uninsured, low-income adults.
I know in Collier County there are approximately 50,000 people who are working and uninsured, or at least underinsured.
The first day we opened, we had 8 patients. It was my husband, myself, my husband's a physician, and 1 volunteer, and we had 8 patients. It was a reality check, and it was a baptism by fire because we had no idea how sick they were.
And like its Port Charlotte counterpart, the Naples Clinic has done it largely with volunteer doctors and other health professionals seeking fulfillment by returning to the mission that drew them to their profession in the first place.
The clinic relies on all volunteers. We have 5 paid employees, and we have upwards of 500 volunteers. We have 247 volunteer physicians and 120 volunteer nurses. The concept, the mission statement of this clinic is, and this is what Bill and I wrote, that we will provide quality health care to low-income adults in Collier County using volunteer medical professionals and private philanthropy, no government money. And we will do it in an atmosphere of dignity and respect for that patient and the kinds of jobs they have.
A lot of our physicians and nurses love to come to the Neighborhood Health Clinic because they're practicing medicine for the right reasons. And they don't have to worry about filling out forms and worrying about Big Brother looking over their shoulder, or having to worry about the strings attached to health care.
But the joy and satisfaction of helping people is sometimes muted by a harsh intrusion of reality.
People today who don't have access to health care usually go one of 2 directions: emergency room or neglect. Any health care issue that is neglected of any magnitude is life-threatening, and survival is an issue. We, here at the clinic, we have had a few people who unfortunately didn't get here soon enough, and we have lost them. We grieve. We grieve for what they've gone through, what maybe we could have done for them if they'd come sooner.
Lucretia Galati of Golden Gate has 2 children and works at a church, but she has no health insurance, a situation she found frightening.
I feel insecure because I need health insurance because of the illness that I suffered from. I have to get medications every month.
Claro que sí. La salud.
My health is most important. I have to take care of myself, and I have to watch what I do and how I conduct myself because of me and my children.
For her, the neighborhood health clinic is nothing short of a godsend.
Temperature's normal.
Para mí es una ayuda excelente.
The quality of care here, I feel that is excellent. As I said before, I need medications every month, and only here can I get it.
Yo quiero
I feel a lot of gratitude for this clinic. I came to this country to work. If I don't work, I cannot make it. And if I don't have good health, I cannot work. And I want to thank the clinic.
The Neighborhood Health Clinic of Naples, like St. Vincent de Paul and Port Charlotte, represent the vanguard of a growing movement that could dramatically alter the way health care is delivered to the needy.
There is a large grassroots movement in the United States for this kind of healthcare option. Depending on what's going to happen with the presidential election, the people in the healthcare profession who really care recognize the scope of this need, and they're just dealing with it. They're dealing with it. They're not sitting around waiting for something to happen. What's going to happen after the election? I have no idea. What I do believe firmly is the concepts such as this will continue to move forward and grow. And you want to know why? I will tell you, because it's for the right reason, taking care of the poor.
Lucretia Gallarte's experience at the Neighborhood Health Clinic converted her from simply being a patient into an activist. She said she was thinking of volunteering her own time to help others.
Lo he pensado.
I have thought about it very often, and yes, I feel that if I could do something, I could be returning some of what they had given me.